class. Today I'm going to be showing you the proper way to assess your patient with the skin, cardiovascular, the respiratory, and the abdominal systems. So the first thing we're going to do is make sure we go and explain who we are. My name is Tracy Neely, and I'm going to be the nurse that's going to be assessing you today. Make sure it's okay with your patient to inspect and ask questions. Is it okay that I inspect you and ask questions?
Yes.
Okay, so the first thing we're going to do is we're going to talk about skin. So when we're assessing for skin, we want to make sure that we look at the full entire area of the body. We want to check for color. We want to check for any bruising. We want to see if the patient has any lacerations on them, any tattoos, any moles, any scars. Also, then we need to palpate. So that means actually touch your patient. Is it okay for me to touch you?
Yes.
So we need to check for perspiration. Is their skin moist? We need to see about the texture. What does it feel like? We need to see if there's any edema. The temperature, is it dry? Is it fragile? And see if there's any redness or any swelling noted to the skin. The next thing is we're going to look at the hair and the scalp. What we need to do first is we need to inspect the scalp and the hair. We need to check to see what color is the hair. We need to see how is it distributed all throughout the head and the density of the hair. And while we're doing this, we also need to palpate. I'm going to touch you now. Is that okay?
Yes.
We're going to feel the hair. We need to check for the texture. How does the texture feel? And the density of the hair. Next thing is we're going to assess the nails. I'm going to look at your nails. We need to look to see if there's any redness, any swelling. Ask the patient, do you have any pain to your nail?
No.
It doesn't have any. So then after we inspect, we're going to palpate. We're going to palpate to make sure what is the texture of the nail, and is there any fragility or firmness to that nail. Also to see if they have club fingernails, or if it's flat or if it's curved. And then that completes the skin system. Next, we're going to go to the respiratory. And on the respiratory, we're going to make sure that we always start posterior. Come to this side so you can see better. So always start the posterior side of your patient first. This way, you're going to be able to access all of the lungs and hear the upper and the lower bases. I'm going to ask the patient to cross your hands over each other so you can see your landmarks, your scapula. You want to start at your apex. But first thing we're going to do is we're going to inspect. We're going to inspect to see the symmetry of the patient. We want to see if their anterior and posterior is equal. Is it 2-to-1 ratio? Also, I'm going to look and see, is the patient having any respiratory distress? Do they have any nose flaring? Do they have any retractions when they're breathing? Are they using their accessory muscles? Is he in tripod position? Does he have any signs and symptoms of cyanosis? Which he has none of this. And then the next is we're going to palpate. We're going to palpate for symmetry. So what I'm going to do is take my hands. I'm going to touch you now, okay? Mm-hmm. We're going to place our hands right up under his postlateral chest wall. Bring our thumbs together. And I'm going to have the patient take a deep breath. And as he takes a deep breath, my thumbs should come back together. If it does, that means it's normal. Take another deep breath. That's one way to check for symmetry. Another is called tactile fremitus. Tactile fremitus is a vibrational sounds in the lobes, and it helps to assess to see if the sound vibrations is increased or decreased. You want it to be normal. So you can, in order to test this, you can take the palms of your hands, or you can take the ulnar edges. You place them on the posterior lobes, and as I place my hands on your back, I'm going to have you repeat the numbers 99.
99. 99. 99. 99.
And so I'm checking this bilaterally on both sides just to make sure that it's equal, that I hear the vibrations equally on both sides, and make sure that I am also testing laterally. And they are. The next thing is I'm going to percuss. And just like the tactile fremitus, I'm going to do it starting the apexes and work my way down to the lower lobes. So I take my hand, find his clavicle right above. I'm going to take the middle finger, lightly tap with your dominant finger, and I'm checking for resonance. And I'm going side to side, comparing, and go down to second, as well as spine, intercostal spaces, and you should hear it. Come down. And that concludes that one. Now we're going to auscultate. That means we're going to listen. Same lobes as we did when we percussed. We're going to start with the apices. As I put my stethoscope on your back, every time I put my stethoscope on your back, I'm going to have you take a deep breath. Again, start at the apices. Again. And we're checking for adventitious sounds, which could be rales, rhonchi, wheezing, crackles. This patient doesn't have it. He has normal breath sounds, which are good. We'll make sure that we're checking on the bilateral lobes. And also we want to check for density in these areas. So I'm gonna, as I'm doing these, also taking these same lobes, I'm going to perform agaphony. And so as I place my stethoscope on your back, I'm gonna have you repeat the numbers 99.
99. 99. 99. 99. 99. 99. 99, 99.
And we're going to do this in all lower lobes as well. And then we're going to make sure that we're listening and make sure that they're equal on both sides. Then we're going to do bronchophony. Same thing, except for on the bronchophony, we're going to have him say E. So as I put my stethoscope on your back, repeat E.
E, E. E, E. E, E. E, E. E, E. E, E. E, E. E, E.
And we're checking for consistency on both sides. And the last one is called whisper pectoraliloquy. And we're going to have him say 1, 2, 3 as I'm listening, auscultating his lobes. Every time I put my stethoscope on your back, please say 1, 2, 3.
1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3. 1, 2, 3.
And I want to make sure that it's equal on all sides. That completes the posterior part. So now we're going to go to the anterior part, and we're going to do the same thing like we did on the posterior part. The first thing we're going to do is we're going to inspect. We're going to look for any deformities in his chest area. We're going to make sure that he doesn't have like a barrel chest, that there is symmetry on both sides. I'm also going to do just like I did the posterior. I'm going to cut my hands to the anterior lateral chest wall. Have the patient breathe in for me. Take a deep breath. Let it out. And the thumbs come together. Take another deep breath. Let it out. And my thumbs come together, so that tells me that the symmetry is aligned. Then I'm gonna do the same thing, the tactile fremitus. I'm gonna either use the palms of my hands or I'm gonna use the ulnar edges. And I'm gonna have the patient, when I touch you, say 99.
99. 99. 99. 99.
Sometimes too, it's a little harder because of women and breast tissue. Just make sure that you move that around so that you can get to those lobes. Then after that, I am going to auscultate. I'm gonna auscultate the lobes starting with the apices, and I'm gonna go down to the 6th rib. Take a deep breath for me every time I put my stethoscope on your chest. Going side to side, comparing, making sure that it's equal. He has normal breathing. It's not labored. And that completes the auscultation of the respiratory system. Now we're going to go to the cardiac. And so on the cardiac, we're going to find our 5 points, and we are going to auscultate. We're going to auscultate these points to make sure that we hear his aortic valve. We're going to do it with the diaphragm as well as the bell on each one of these. So aortic valve, pulmonic, Erb's point, tricuspid, and mitral. Okay, I'm listening again. Aortic, pulmonic, Erb's point, tricuspid, mitral valve. And then I am going to inspect and palpate for his PMI, so the point of maximal impulse. And how I do that is I place my hand, left hand on the precordium, other one under his breast area, feel for the pulse, and make sure that it's vertical to the mid-clavicle space. And I feel it right here. And I'm going to count for a solid minute. That's where the PMI is, and I'm gonna count, his apical pulse is, but that's where the PMI, and we're gonna count for a full minute to be able to tell you the rate and the rhythm. You always wanna make sure you have a watch with a second hand. His heart rate is 86 and it's a regular rhythm. And then that concludes that portion. So the next one is we're gonna assess the jugular vein distension and pulsation. So we're gonna have your patient lay down. So patient, if you don't mind laying down on the bed. And what we're gonna do is we're gonna make sure that your patient lies with the head of bed either 30 to 40 degree angle. We're gonna look to make sure that we look for their jugular vein. Make sure that there's no distensions. Also, another way to measure is you can use the sternal angle to measure using with a ruler. And once you have that ruler, if the jugular vein distension is 2 centimeters or less, it's normal. If it's more than that, then there's a problem. The next thing we're going to check is for heaves. And heaves is to assess for hyperventricular hypertrophy. And so again, You got the landmarks. And I'm having a patient take a breath in and out. And if you feel a heavy heave or lift, that means it could be an indication of ventricular hypertrophy, either on the right or the left. And then we are going to listen for each of the each of the 5 areas with our stethoscope. The aortic valve, we're listening for thrills. Thrills is murmurs. So listen for the aortic, pulmonic, Erb's point, tricuspid, mitral valve. And he doesn't have any thrills. So then that completes the cardiovascular. Now we're going to go to the abdominal. So the abdominal, we're going to inspect. What you want to do is you want to look at the contour of the abdomen. You want to make sure that it's symmetrical on both sides. Make sure the abdomen is flat, rounded, protuberant, which it's not. And then we are going to auscultate, which is listen. We're going to listen to all 4 quadrants. Right lower, right upper, left lower. Excuse me. And we're going to see if we hear bowel sounds. They can either be normal active, hypoactive, or hyperactive. So we'll start with the right lower and listen for bowel sound. Right upper, left lower. And I hear bowel sounds in all 4 quadrants. Now I'm going to assess for bruits. So aorta. Then I'm going to listen for the renal arteries, the iliac arteries, and then, patient, femoral. And the femoral should be right here, almost in the groin area on both sides. You want to measure on both. You want to listen to both sides. Then after that, you want to be able to percuss. You want to percuss in the right lower, right upper, left lower, left upper, left lower quadrants. You want to percuss just like you did on your anterior, or just like you did on your posterior. You take your finger, you're checking for tympany, dullness, or flat. And with your middle finger, lightly tap. And you should hear it's like a thud. And you're looking too for facial grimacing if they have any guarding when you're doing that. Then you want to palpate. You start off with light palpation. You start off again the right lower quadrant. Light palpation is depressing no more than 1 centimeter. And so you start on the right lower, and you, in a circular manner, and you ask your patient, do you have any tenderness or pain when I palpate?
No. 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 No.
Then deep palpation. Deep palpation is between 5 and 8 centimeters. And it's a little bit deeper. And you're just feeling around, looking for tenderness, guarding, or pain for the patient. You're also you wanting to palpate over this liver to make sure that patient doesn't have any guarding or grimacing, and then over the spleen. Do you have any pain? Okay. And then the last is the CVA tenderness. Come on, let me get you to sit up right on this. And turn around the back. And what you do is you look, you see where the 12th rib is, and then where the sternal or the spine goes together. 12th rib shows an angle. Put your hand right in there. That's where the kidneys are. You're assessing to see if they got any kidney infection. Put your hand, ball your fist. I'm gonna lightly tap, and you tell me if you have any pain.
No.
Come over to this other side. Spine, 12th. Right here.
No.
I'm sorry. Yeah.
No.
Okay. And then that completes the assessment. Do you have any questions?
No, ma'am.
Thank you.